Hello, my favorite learners. That's how I'm going to start every single video that I post. Today, I really want to go over how to do an anesthetic pre-op. So this is going to be just your straightforward adult anesthetic pre-op. So everyone does it kind of differently. If you have any suggestions to add to what I do, please feel free to drop them in the comments. But like, subscribe, all those things, and I can continue to do this. So first things first. Let's get into an adult pre-op eval for SRNAs, CRNAs, any anesthesia learners. I'm not in full garb, but eventually I'll start to be very theatrical and actually wear scrubs and a cap and all the things to make it more realistic. So this is how I start my anesthetic pre-op. Hi, good morning. How are you? Let me check your ID band to verify you are who I think you are. Can you give me your first and last name and date of birth? Okay, thank you very much. What procedure are we doing for you today? Awesome. Thank you so much. I'm going to ask you some questions that I ask you for safety reasons. I know you've been asked these a million times, but again, we just ask them for safety reasons. Anything to eat or drink past midnight? No? Okay, perfect. Any recent cough, colds, or flu? No. Okay, good. Any medication allergies? No? Awesome. Have you had anesthetics in the past? Oh, any issues with those anesthetics? Post-op nausea, vomiting? Any issues throughout the intraoperative course, pre-op, intra-op, or post-op? No? Okay, great. No family history or problems with anesthesia that you're aware of? No? Awesome. Any history of seizures or strokes? No. Any heart problems, heart murmurs? No? Okay. Ever had a heart attack, chest pain? Are you able to make it up a couple of flights of stairs without getting chest pain or shortness of breath? What do you do for exercise? Oh, you walk a couple blocks around your block a couple times a day? That's great. No shortness of breath or chest pain with that? Awesome. Any lung problems like asthma? No? Okay. Do you smoke? Okay. How often do you smoke? How many cigarettes a day? Or what do you smoke? Oh, you vape. Oh, it's a weed vape. Okay. How often do you do that? And when was the last use? Okay. Thank you for sharing that with me. Any liver, kidney problems? No? Any diabetes? No? Okay. Any reflux issues or heartburn problems? Not that you know of. Okay. Open your mouth really wide, stick out your tongue. Awesome. Any chipped teeth or loose teeth in there? No. Any caps, crowns, veneers with recent work in the last 6 months? No. Okay, good. And then I go into my anesthetic consent if the facility that I'm working at requires me to do that. Some facilities have the attending anesthesiologist do the consent portion, so I don't have to go through that. However, if I'm working independently, I would obviously do that. And that is how I do my anesthetic pre-op. If you have patients that say yes to any of those questions, seizure or stroke, obviously you would go into when was the last seizure? Are you on any seizure medications? If they've had a stroke in the past, you'd want to know when it was, what type of stroke it was, if they're on any medications to prevent future like thrombolytic strokes, like I am having a stroke right now. And then you would ask them, if they have any residual weakness or any residual issues with their stroke that they've had in the past. So you kind of go through that algorithm. And again, I've posted it in a little YouTube short, but here is the anesthetic pre-op shortcut that I use. The reason why I start with anything to eat or drink past midnight and any recent cough, cold, or flu is because if they answer yes to those questions, I'm canceling the case potentially, and I don't need to go into the rest of my pre-op. So it saves my breath. So if you say anything to eat or drink, oh, well, yeah, actually I had eggs this morning. And if this is an elective procedure, it's either going to be very delayed or canceled completely. So, and any recent cough, cold, or flu, that could definitely cancel your case as well. So that's the reason why I start with those. If you have any questions or concerns, let me know, put them in the comments, and thanks for watching to my favorite learners.